Hi everyone, it's Dr. Dave and I am coming back with this week's Thursday's Medical Minute. Okay, one question we are asked a lot in medicine and especially in cardiology is, what are the long-term effects of COVID-19 infection when it comes to heart? And there was a study that came out this past week in the Journal of the American Medical Association out of Germany, where researchers looked at 100 patients who had COVID-19 infection, documented infection, on average 71 days later. And they put these patients through an amazing technology called a cardiac MRI. Cardiac MRI is about as good as we can get in terms of visualizing the heart. It's very, very sensitive. It's not commonly used. It's usually used in research, but it is really excellent in detecting details. And what they did was they put these patients, all 100 of them, through a cardiac MRI. And they found that 78%, 78 out of 100 had some type of cardiac involvement. Now, this is concerning. And, when I first read this paper, I was really upset and really had to know more. But then when I read more, I realized that they report 60% of the involvement really is inflammation. So the heart muscle can be affected and can be, you can have some scarring of the heart muscle. You can also have inflammation of the heart muscle, and you can have inflammation around the heart muscle, the pericardium. So what you can see here is, this is the heart, and you can see it squeezing. This is the muscle, the white is the blood. So you can have damage or scarring, I should say, of the heart muscle, but it was a small amount, not a large amount. And you can also have inflammation around the heart called the pericardium, which is a sac around the heart. So the vast majority of patients in this study had cardiac involvement, but when you look at the details, it really is apparently mild involvement. And, lots of viruses can affect the heart, and we don't know if this means anything long term. Will it resolve? Most of the time inflammation will. Does small scar tissue mean that somebody's going to do worse long term? We just don't know. So it is something that definitely needs to look into further. Do you need to rush to your cardiologist after having COVID-19 infection? Probably not. But if you're having symptoms, persistent symptoms, or residual symptoms, shortness of breath, chest pain, you should definitely get checked. So that's the story on COVID-19 and long-term effects of average 71 days after infection. I also want to end by adding most of these patients, 2/3 of these patients were at home. They were not hospitalized. 1/3 were hospitalized. And I think only 2 required mechanical ventilation. So even with mild symptoms, COVID-19 did have some effect on the heart. Okay, so as more studies come out, I'll come back to you guys and keep you updated. And until then, stay healthy. This is Dr. Dave.